So with that, I think we can move on to the first substantive paper, which is the Commissioning Board Programme Update, which, Bill, you're going to take us through.
Thank you, Chairman. This is our regular report that comes to the board on each occasion, updating us on progress with the programme for which we're responsible. I'll just pick out some of the main points, and then I might invite Joe Ross to talk specifically about the HR recruitment challenge, which is probably our biggest challenge over the coming months. Significant progress, I think we can report since we last met, and some of that's itemised here. I think I'd pick out, in particular, the meeting which the Chairman Malcolm Grant, Dave and I had with Secretary of State, the last accountability meeting, where we discussed progress with the Commissioning Board Authority and had a particularly good and very open conversation about the nature of the mandate. And picking up on previous discussions here, I think we were very clear that we believe a high-level mandate focused on aligning the whole system towards achieving outcomes involving clinicians in decisions throughout the system and being open to patients in a way that perhaps the NHS hasn't done as well as we should have in the past, was what we wanted to see at the heart of the mandate. And that was important to give the right degree of freedom for local clinical commissioning groups to innovate and bring about the changes that they want to for patients and local communities. I think the minutes of that meeting are due to be published probably later on today, so maybe something the board will want to look out for. We've advanced on a host of our partnership arrangements over the past month, and we've really focused on those which we think are going to be most strategically important for us in the short run. So we have a set of arrangements which we wish to have turned into partnership agreements by October, and particularly with Monitor, Care Quality Commission, NICE, Public Health England, the Trust Development Authority and local government. Those seem to us to be the partners that we need to have a really good understanding between ourselves so that we can really use our complementary roles and levers we're going to have to support the improvement in outcomes and the right partnership with local clinical leaders. That those are going well, I believe. Probably the most complex is with Public Health England, where there is a sort of a triumvirate of discussions with the department, who will set the Section 7A agreement, which gives us our specific commissioning responsibilities for public health, with the Public Health England itself and the kind of advice that we'll want to get from them and the advice they'll need from us. So there's a fairly complex set of agreements to be worked out, and I think that will probably require the board's focus and attention over the coming months. We've made, I think, good process set out here in some key appointments, particularly completing the executive team as well as the 4 regional directors, and that's set out. It does feel like we're getting that critical mass of top leadership at the executive level with the right sort of ownership, the right sort of acceleration and delivery that will bring with us. But as I think the paper sets out clearly, we shouldn't underestimate the challenges. This is a very complex time for us. It's a time when the NHS has to focus on its operational delivery as well as creating the relationships, institutions, the focus for the new world, and inevitably that carries a degree of risk with it. One that we'd probably highlight is around emergency preparedness, resilience, and this isn't a risk about the theory. I think there's been really strong work between public health community, the department and ourselves to set out how this should now work in future. But it's about implementation, and it's about forging the new relationships locally. It's about having absolute clarity of responsibility. And in that light, it's worth just reminding ourselves that nothing changes till it changes. So, you know, our new responsibilities come on board next next April. So while we're talking about building the new systems, the clarity of accountability is absolutely there. Existing SHAs, departments and PCTs keep that responsibility right the way through this summer, the autumn and the winter for emergency planning and resilience. And that's something we'll keep reiterating to the service out there. We've, as usual, summarised at the back in the way we do, Chairman, the key challenges and risks that we're facing, so that there's so that we're very open about our progress on those and the nature of them. And of course, in that we've talked before about recruitment and going from 161 different organisations to one, and bringing on board the 4,000 people that would be part of the single commission board organisation. And Joe Wass, I think, was going to just update us, if that's okay, on progress with that.
Thank you, Bill. And yes, Joe, would you like to do that?
Yeah, thank you, Bill. When the board met last time, if you recall, we discussed the recruitment strategy, which is how we move from where we are now to filling around 4,000 posts that the board will have. And we talked about that activity starting in May and ending in December. So it's started. As Bill says, the recruitment to the executive team is now complete. We have recruited also 4 regional directors, which is very significant because they help us with the organisational design and the rest of the recruitment to the area teams. So we are now in the midst of recruiting our senior manager cohort, particularly those to the National Support Centre, people who report to the national directors. And we're right in the middle of that. We're shortlisting. We're just about to start interviewing. I think the point that I'd like to pull out of Bill's paper related to this is the stuff about organisational design. I think it's really important that we focus on this now. It's quite a significant issue in the critical path. So we need to kind of finish the organisational design. And some of these appointments that we're now making are really important to that. We touched earlier on the OD strategy. All that work is happening in parallel. So we've done quite a lot of thinking since the last meeting about the OD strategy. But I think what's really important about that is that we build it with the people that we recruit, particularly with the senior leaders. So at the moment we're thinking about what kind of organisation we want to be, what we stand for, what our values are. We've done a lot of thinking about that, but as we bring people on board, we want to kind of build that with people as we go on, which I think is by the time we get to September, we'll have a very good feel for what that might look like. I think Bill points out that we're getting getting a head start now on the leadership field. I think from next month we will start meeting as a whole leadership field, so the national directors, the regional directors, anyone else that we've recruited, and as we bring people on stream we will meet every month as a leadership field so we can build the organisation together, so we can problem solve together, and so that we can develop the OD approaches together. Good,
thank you. I take questions of Bill or Joe on the programme update.
May I ask
Kieran.
Joe, it's more around the people. Are we going to get the right people in quickly enough to do the work that needs to be done for the other things in the critical path? Because it's great in theory, but...
Absolutely, absolutely. And you're right to point out, because I think at the last meeting we talked about reviewing the plan in June and in October, and the reason I think it's important to review it in June is because by that point we should have recruited the majority of the senior leaders to the organisation, and they're really critical to recruit the others. So I think when we meet next time, I think we maybe want to take stock of that.
June does start tomorrow.
Yes, I know, the end of June, sorry.
Okay, and any other questions of Bill? So I think the board is asked to note progress with the delivery of the programme, to recognise the enormous amount of effort that is going in to construct the organisation, and also the fact that time is marching on, and we have a summer and autumn of considerable work to be done. But thank you, Bill, for that paper.